If you didn't know it or not, this is the time of year we must begin to deal with colder temperatures and unfortunately days of inclement weather. Along with having to add coats and scarves to our wardrobes, this is also the time of year that brings the greater potential of health-related problems. One way to prevent illnesses is to protect yourself by getting vaccinated, and it could protect you and your loved ones from an assortment of illnesses. With us to talk about the benefits of getting vaccinated is Joanne Douglas, Administrative Coordinator with Wake County Human Services. Thank you so much for being here.
Thank you.
What are vaccines and why are they so important?
Vaccines are a way that we deliver immunizations to the body to protect us from communicable diseases. And immunizations are very important for individuals to protect yourself from a whole list of diseases, from hepatitis B, measles, mumps, rubella. And it also protects our family and our community. When we have a well-immunized community, we protect each other.
Now, we hear a lot about vaccines for children. Are they safe and effective?
Yes, they are. They are safe and effective. Millions and millions of children receive millions of doses of vaccine every year safely and keeping them healthy and protected from disease. And while we don't hear about all the success that vaccines provide, we do hear some controversial topics where vaccines are concerned. And we tell patients to ask your doctor, be skeptical, ask questions.
What about adults? Anything new out there that adults should be aware of?
Oh, yes. We say that vaccines are not just for kids anymore, and that adults should be asking questions of their providers when they go in for physicals about what they need. There's vaccines for shingles, also tetanus and pertussis. This is especially important if you're a grandparent or a caregiver of a young child that can't receive the vaccine themselves. You protect them from whooping cough disease. Pneumonia is another that we associate flu and pneumonia together, especially for people 65 and older. And if they're going to travel outside the country, we're hearing about polio. So adults definitely should be assessing their records and asking questions of their provider.
Another segment of community that could receive these vaccines and it would be helpful, pregnant women?
Indeed. Pregnant women. There's a recommendation now for the Tdap vaccine. It's tetanus and pertussis for women that are beyond their 20th week of pregnancy. Flu vaccine is recommended for women that are going to be pregnant during the flu season, and it's strongly encouraged that they receive that.
When we're in the midst of the flu season now, how is that going in regards of folks coming in, getting their shots?
Very well. We've had a good demand for flu vaccine at our health department. I hear in the community that they're really giving the vaccine. This is a perfect time of the year to receive it. It takes about 2 weeks to give you immunity. And you know, it's the holiday season and you're going to be around maybe extra people traveling out in the mall. So you want to be protected before you go out there and are in large groups where the flu virus spreads very easily. And the flu vaccine protects you for the entire flu season.
Let's say someone is watching and they're interested in trying to find out any special programs in the community that deals with immunizations, or are immunizations available at Wake County Human Services?
I'd like to tell you about, we're very fortunate in the United States and especially in North Carolina to have the Vaccines for Children program. So this program works with the CDC to provide immunizations for children under 19 years old that maybe don't have insurance or their insurance doesn't cover the full cost of immunizations. They're Medicaid eligible or they're from certain ethnic groups. These vaccines are provided at no cost to the child or to the parent, and they're available at the health department. They also are available at most pediatric provider offices.
And a phone number for folks to get in contact with someone?
You can call the main line at 919-212-7000, and they'll put you in touch with a clinic that's close to you. Or you can check the website, wakegov.com, and we have a section for health clinics and health information that I hope will help people get what they need.
Joanne Douglas, Administrative Coordinator with Wake County Human Services, thank you so much for being here.
Thank you.